Thank you, everyone, for attending. We'll have more people trickling in, but we want to get started so we give Jennifer Pepper and Dr. Nakia Grayson enough time to talk about this very important topic. It is the absolute pleasure of the Institute for Global Health Sciences and the Bixby Center for Reproductive Health here at UCSF to have representatives from Choices, the Memphis Center for Reproductive Health, here today to talk to us about the red state providers and the path forward after the fall of Roe. Jennifer Pepper and Dr. Nakia Grayson have been amazing friends, colleagues, thought partners to us here at UCSF and are doing work that is unbelievable. They give their heart every day, and it has been a pleasure to know them and work with them. And I know no one's here to listen to me talk, so I will pass it off to them and let them start off.
Hey everybody, welcome. We can go ahead and do the next slide. We'll take a second to introduce ourselves. It's just a pleasure to be in connection and in company with everybody in the room and the folks on the web. So thanks so much. I am Jennifer Pepper. I'm the president and CEO at Choices. I have been with Choices in a variety of roles. My very first job was a couple of decades ago as a part-time abortion counselor. Written the first grants Choices got an MBA along the way, and just honored and pleased to be able to serve my community in this role every single day.
We're happy that you're there.
Thank you.
I'm Nakia Grayson. I am Chief Clinical Officer and a family nurse midwife at Choices. I joined Choices in the summer of 2017 when I came to start our midwifery and birth services, and the expansion has been amazing.
Next slide. So we wanted to start by laying the context for where we've come, where we're at, and where we're going. And so this is a group of our founders. So I like to start this story by saying on a dark and stormy night, 1974, because I think that's where all good stories of triumph and overcoming start, on a dark and stormy night. But a group of feminists got together in Memphis, Tennessee, and started a nonprofit, hired doctors, bought a building, and started a clinic to provide first trimester abortion services. They had waited for about a year after the Roe v. Wade decision, and the doctors in town, the hospitals, didn't start providing. And so they did it themselves. And we were the first organization in Memphis to provide abortion services. And that really started a long line of firsts for Choices. And that's actually our founder, in the foreground, sitting on the ground to the side of the sign, Priscilla Chisholm, and she passed away just a few years ago. But she was able to tour our brand new facility and see where Choices had gone in the 48 years since she founded. So like I said, for the first 35 to 40 years, Choices provided first trimester abortion services. We were the first provider, and then we were one of two. And at the height, there were 3 abortion providers in Memphis. We're back to 2 providers in Memphis. Next slide. So this is Choices' mission and vision. We're healthcare providers. We provide patient-centered medical care, and we champion the sexual and reproductive rights of our patients, our staff, and our community. And we envision a world where those rights in healthcare are recognized as essential, and we don't have to have debates and conversations and SCOTUS cases to protect the things that people deserve access to. Next slide. So I mentioned Choices has a long line of firsts, being the first abortion provider. We also partnered and were the clinical site to pilot the Rape Crisis Center that is still in Memphis serving the community today. We were also the first folks to provide gender-affirming care in our community about a decade ago. We were the first folks to provide family planning to people living with HIV, either in serodiscordant couples or sero-similar couples. We were offering sperm washing services before the advent of PrEP, about 5 years before the advent of PrEP and PEP. We were one of the first organizations in town to offer PEP and PrEP to folks. And so Choices is in our cultural DNA to respond to our community's needs and to be brave and courageous enough to be the first. And so this is a picture of our staff in 2018. That is my predecessor to the right of me in the black and white striped shirt, Rebecca Terrell, and the comprehensive center that we have today really started as Rebecca's vision and dream, and this was the groundbreaking for our new center in late 18. I think if you click, there might be
Another picture.
Next slide. So this is the brand new center that we built. It's 15,000 square feet. It is the home to the first and only birth center in Memphis. And in 2021, we saw over 5,200 patients and provided almost 4,000 abortions. We saw, we had over 400 appointments for gender affirming care, and almost 1,000 for no-cost contraception appointments. And you can see the vast majority, 69% of our folks, our patients, receive some form of financial assistance. And that is from external sources, but also Choice's own internal financial assistance structure for folks. Next slide.
Yeah, so this is a picture of one of our beautiful birthing suites in our new facility. We moved into our new facility in September of 2020. And at that time, we were one of the few, and actually we are the only organization in the community that provides community birth and midwifery services. So in 2017, on track with what we've been always doing, which was being a first, we added midwifery services where we added prenatal care, but also community birth options, and really added access to birth services for families that historically had not been able to have an out-of-hospital birth. We started this services, like I said, in 2017, and we're just really proud of the services we've been able to provide. The majority of our patients reflect the city of Memphis. Memphis is a predominantly Black city. I would say the majority of our patients are Black. The majority of our patients are also on Medicaid. And this is purposeful. We center families that are on Medicaid. This is really important because those families are usually the ones that have been traditionally unable to receive midwifery care and out-of-hospital birth options. So last year we did 84 births. We did over 700 prenatal appointments. And this year we are on track to do over 200 births in our new building. We're really excited about that. Next slide. These are some wonderful statistics that Alden here at UCSF has really helped us to tease out our data. We have a lot of data. We collect a lot of information about our patients. And fortunately, the collaboration that we've had with UCSF has allowed us to really put into words what it is that we already knew, which was that the patients that we see are less likely to have a C-section, 5.32 times less likely to have a C-section, and that they are 3 times less likely to have a preterm birth. And what's really interesting about this information, this data, is that we haven't even really drilled it down to even more variables to show that especially Black families are being treated in a way that they should be. And so we're really excited about it. We're excited about the help that we get from UCSF. And we're really excited about the work that we're doing. Next slide. This is one of our patients. Actually, she and her sister were in care at the same time, which is really interesting because they both had really different birth experiences. One we ended up having to birth in the hospital, and then the other we had at home, and they both were really happy with the outcomes. But one of the things that I always say is really important to us is that we provide high quality, non-judgmental care, and that people that come to see us, whether they're pregnant and want to continue their pregnancies, or pregnant and don't want to continue their pregnancies, they know that they have an ally in us. And so that's really important to what it is that we do. We know that our model of care works. Providing excellent care to our patients is of the utmost priority for us. And we recognized many years ago that really just being an abortion clinic was not the way to be. We realized we had more assets and more resources to provide our community. And what Choices has historically done is answer the call of our community. And so our community told us what they needed, told us what they wanted, and we, in partnership, have been able to produce that for them. I tell everybody that we recognize that our patients are the experts of their lives, and that we have a resource and that we have a skill that can help them to have better health outcomes. And that's what we've been able to do. Next slide. This is the team. So in 2020, we really started talking about having a Midwifery Fellowship. When I started at Choices, there were no Black community midwives. And so it was sad and lonely being the only. And so one of the things we really wanted to do was be a space where we could train our future providers, right? And wanted to be a place where we can train them in a model that is rooted and grounded in social justice principles, rooted and grounded in reproductive justice principles. We had already switched our own model to be a reproductive justice clinic, and really working to operationalize what reproductive justice is and what it looks like. And so one of the things we realized we needed to do was also to be a place to train future providers. So presently in our clinic, we see residents, we see nurses, we see nurse practitioner students, but we also have midwifery students, and now we have midwifery fellows. So we started with the support of UCSF and some other friends in the community. We started a Black Midwifery Fellowship this year, and so we have 3 new fellows. They're new CNMs, new certified nurse midwives, and the one in the middle, actually, she graduated from UCSF. Her name is Chantel Davis, and all of them have been amazing. And so this is our team of Black birth workers. We have 2 Black midwifery assistants, and then we have 3 primary midwives, myself, Kamitra King, Talita Asagara, and then we have a midwifery fellowship coordinator, Maya Janelle Peak. And we have our 3 new fellows, which are B.A. Goodrum, Chantel Davis, and Shay Street. Next slide.
So Choices over the last decade has built this really comprehensive and beautiful practice. And I think it is the embodiment of what choice looks like for folks. And it feels really amazing to be part of that. And unfortunately, we are going to lose abortion access in Tennessee this year. And so we, living and providing this service in the South for almost 50 years, Choices will probably outlive Roe, unfortunately. We've seen this coming for a while. Yeah. It's gotten harder and harder for us every year to provide care to patients. It's gotten more expensive, and that's the game, right? It's not, that was by design, right? That's how you often, it's a long game, right? So when the Supreme Court took up the Jehu case this last fall, we kind of all looked around at each other and said, this is going to be bad, y'all. Like, this is going to be bad for us. And so we had been talking about, we've been doing this visioning and dreaming and strategic planning, and we had decided, our end game. Lots of nonprofits have missions, but we were forming our end game, right? How will we know Choices has reached its charitable purpose, right? So it's like when all healthcare looks like this, when healthcare is comprehensive and people's choices are honored at their healthcare provider, regardless of what it is.
Right. I think that also, we worked really hard at, when we added the midwifery services, I'm sorry.
No, please.
We recognized that, we were serving the same people at different points in their lives, right? And what was really interesting about us deciding to do midwifery was, I think the Choices had been used to dealing in stigma. We were like, we're stigma or us, right? So, midwifery is highly stigmatized, especially in the South, and not really well integrated into the healthcare system in the South. And so is abortion, right? And so, like I said, we realized we were just taking care of people at different points in their lives. And so also we recognized that a lot of the barriers that people were having in accessing abortion care were the same barriers they were having in accessing midwifery care. Yeah. Lack of providers. Yep. Insurance issues. Insurance didn't cover abortion care, didn't cover midwifery care, and then they had to travel long distances to access this care, right? And so when we recognized where we were heading in terms of moving abortion access, we also realized we needed to diversify our services.
Exactly.
And that's how we got to where we are now.
Yeah, exactly. So Choices started diversifying services and adding services. And when the Affordable Health Care Act passed, we started to take insurance. We'd never taken insurance before because it didn't cover abortion, which was our primary service. So we started building that muscle and organizational infrastructure. And thank goodness, because that is what has put us at a place to meet this moment, right? So when they took up the Dobbs case, and then we listened to the oral arguments on December 1st, and we'd already been talking about permeating our model through the system. And one of the ways we had decided we were going to do that was through increasing our footprint in places where it made sense, right? And so we are looking at forming partnerships and collaborations in states that have protections around abortion access, and deciding how we can move in those spaces and support those organizations and support our patients. Unfortunately, there is a lot of unknown at the state level in places like Tennessee. We're going to have to wait for the Supreme Court case to happen and then see what our state legislator does. And then we will decide exactly what our course of action is and move forward. But what we know is we saw almost 4,000 patients for abortion last year. And so those people need us, and they need us to help figure this out for them. And so that is what Choices is committed to doing. We will, once we're no longer able to do abortions in Tennessee, we will ramp up all of our other services and provide as much midwifery care and wellness and GYN services as we can. While as a country and as the South, we are figuring out how to get abortion access back, right?
But we're committed to being present and continue to provide care. What's really interesting also is that the South, and particularly Tennessee, what we're facing also is not just the loss of abortion care and rights, but also the criminalization of pregnancy and pregnancy outcomes. And really, how do we move in this time, right? And how do we continue to support people and help them protect their reproductive destiny, right? And so that's what we're looking at now, and how, as providers, we have to move in this space, especially when not only abortion is being criminalized, but also providers are being criminalized. And so we will continue to provide abortion services all the way up till, as Jennifer said, the buzzer.
Until the buzzer goes off.
Yes.
And we'll draw the fouls for my sports ball fans in the audience.
Yes. And then we will make plans. Fortunately, we are working with other organizations in other states to talk about how to be able to move people around to get to the services that they need, which is really unfortunate, right? Because we should not have to do this, even though in other areas, especially in the South, Roe's existence has not been really realized and fulfilled for them, right? In Mississippi, we have the one clinic, and a lot of those patients that we see, or a lot of those people in those states, we're seeing them move into Tennessee, and they have been for some time because we are as far southwest as you can go in the state. We see a lot of patients from the bordering states. But what we're seeing now is patients that are coming from states even further away for basic care, and this is unfortunate. So as abortion providers, we're now looking at ways that we can pivot, right? And so this is really timely and really relevant to midwifery as well, right? Because midwives have historically been providers of both abortion care and birth care. And so one of the things that's really important to us is that we brought these things back together, and we have that conversation around both of them. I tell everybody I'm a midwife that provides care for pregnant people who want to be pregnant and who don't want to be pregnant. And so we have to really continue to work to destigmatize abortion in our communities.
So this is little, but these are just some of the things that are in place to help to make it harder for providers to provide abortion care and for patients to access abortion care. And so on top of just the challenges that exist to accessing healthcare in communities, right? That baseline is still there. And then if you're talking specifically about abortion, we add all these additional layers of complication regulation onto it. And so it is just so challenging.
It is challenging.
It's so challenging.
Yeah. I mean, there are new trap laws, and trap laws are targeted regulation of abortion providers that are introduced every year. We are kind of used to having to pivot.
Our lives, usually a legislative session ends in April. Once it ends, we spend the next couple of months preparing to comply with whatever new regulation has gone into place. And they usually go into effect in July or October, or sometimes in between. And so just the number of hours that our staff spend with attorneys, regulatory boards, other providers in the state, because to figure out how to comply with these things, how to not pass cost on to patient, how to continue to provide service. I mean, it is a regular part of our planning, of plotting our plans for the year. We have to plan for huge chunks of times to plan around compliance.
Right.
And we've had a new one to have to figure out every year since 2016. And so it has become like, okay, it's legislative session. Let's see what happens. And then we'll spend the spring figuring out how to provide abortion despite all of this, right? And so I mean, the answer is going to be federal legislation of some kind, right? The state by state. And it is bigger than abortion, right? Because the same states that are regulating and trying to eliminate abortion access are also working around eliminating trans healthcare, especially for adolescents and in pediatrics, and just voting rights are where it comes down to. Like, let's be clear about that. That's not the topic I'm here to talk about today, but it is not that those of us in the South are so backwards and conservative, right? It's that our voting districts and things have been gerrymandered to the point where our votes really do not count towards much. And so as primarily folks from outside the South, I would really encourage you to take that perspective on Southern politics. Yeah, next slide. It's gonna happen.
Yeah.
I want to be wrong. I've never wanted to be wrong about something so bad in my life.
Yeah.
I don't think we are.
I think that also you need to tell them a little bit about the bill that was recently, I guess, pulled.
Yeah, so sure. So we were facing down a Texas-style ban, and it was even worse because it actually included language around aiding and abetting, right? That's the surveillance piece Dr. Grayson kind of alludes to. And so it actually got stopped in the Senate committee because the lieutenant governor was the author and gets the credit for the current abortion ban that Choice is suing the state of Tennessee over, which is this latter ban. Says abortion is illegal at, I think it starts at 6 weeks. If that's upheld as unconstitutional, it just triggers, it goes to 8 weeks, 9 weeks, 10 weeks, until it figures out whatever number is now acceptable within our democracy. And so, but our understanding from talking to the folks in Nashville is folks are waiting, and it's not just Tennessee, it's in many of the other states and in all the district courts. All the movement on these cases has stopped because they're waiting to see what the Supreme Court's decision is.
Right. And we know that in 2017, there were 12,000 abortions performed in Tennessee alone. And so many of these families will find themselves in a position where they, if they need to have another abortion, they won't be able to have it in the state of Tennessee. And so, like I said earlier, a lot of these people are the same people we see just along the different spectrum of their life. And so we have patients who come to us and may be ambivalent about the decision, who stay with us for prenatal care and have their babies with us. And then we have those who don't want to stay pregnant and terminate. But what we find is that we're seeing them.
And many that do both.
Right, many that do both. We have many that have done both, and many that access many of our services, not just our abortion services, but our prenatal care and birth services, and also our family planning services. And we are one of the few clinics that provide free contraceptive options to our families. This is really important to us that we provided all the options also, because we didn't want to just provide LARCs, as we know LARCs are wonderful. The device itself is fine, but
There's some complexity there.
yeah, some complexity there, right? And so we wanted to make sure people had access to all of the birth control options that are available. And so one of the things about Choices is, fortunately, because we have really been planning and thinking about this, we will be able to be around for this fight and be around to continue to provide care to people. Yes, abortion bans have been devastated, have had a devastating impact on our families, especially for Black families and Black community. Of course, we know historically there that we have faced a lot of discrimination in medicine, and that we continue to, right? And so we're not, one of the amazing things that we're doing at Choices is really addressing that discrimination and that historical racism that we continue to see this perpetuated in our medical community, and that is really affecting people's access, but also their outcomes, right? And so many people that we care for traditionally would have been seen later in pregnancies because of their experiences with the healthcare community. And so one of the things is that we are really working hard on is changing that and changing people's experiences, but not just change their experiences, but really helping them to understand how they should be treated by the healthcare system. That's really important to us.
Excellent. Well, if that's not the $1,000,000 question.
What can I do now?
I'll take an aside because they put me in charge, so I can do this. So I find this picture, you need to laugh or you'll cry, right? That's kind of our philosophy around Choices. We recently, because we had two very courageous county commissioners, Amy Sawyer and Mikkel Lowry in Shelby County, granted us a grant from Shelby County government to build a playground on our campus, right? Because third of people that have abortions already have children. Moms that are coming to give birth already have children, right? So our staff have children. There are children in our center a lot, right? It's one of the really great things about Choices. But there was a lot of pushback, and Dr. Grayson and Holly and I and other staff sat in the county commission chambers for about an hour and a half one day, just listening to community member after community member talk about how terrible we were and how we were not an asset to the community. And because we wanted to build a literal playground, that is not a figurative playground, a literal playground for the children while their parents come to access healthcare. And so I think it just really, it kind of brings into sharp focus the hypocrisy of all of it, and just the absurdity of what we're trying to do and what people think. It's like those memes, like what I do, what my parents think I do, what the community thinks I do, right? So what we actually do. So what can you do, right? I think the truth of the matter is, as far as abortion access goes, we have to have national, federal legislation. That's what we need. That is what we need, right? I think we're going to lose abortion in a vast majority of the states, and I hope that fires people up, right? But there are some things that we can suggest for you to do, and we want to lift up some of our partners and their important work.
Slide. What else we can do is not build any more single focused clinics, right?
Yes.
That's one of the things we can do. We can support comprehensive reproductive health care clinics, right? Because, maternal health is not just about pregnancy. It's about access to contraception, access to family planning, and access to STI testing, and all of these other things that people need in the community. So I think that part of the problem has been that the focus has been, abortion only, right? And so one of the things that we really have worked hard to do is move away from that and recognize that comprehensive reproductive health care is really the way to go.
Abortion is important, right?
It
People
is,
need
yeah,
abortion,
absolutely.
but they need lots of other things
Things
too.
Right. And
Like-
things that are within our ability to provide.
Exactly.
Yeah.
Exactly. Yes.
Yeah.
So stay informed, right?
Yeah.
These are some good groups. Healthy and Free Tennessee and Sister Reach are Tennessee based. Sister Reach is the first reproductive justice organization in the state of Tennessee. Dr. Grayson is a board member, and Healthy and Free Tennessee is our advocacy group. And then those are some national orgs that everybody's probably familiar with. Next slide. And support abortion funds. So as Dr. Grayson and I are talking to people, right, they're like, well, how will people get to Illinois, California, New York? Like, how, you know, and our answer is Choices provides healthcare, right? That's what we do. But there are abortion funds across the country that provide practical support and financial assistance to patients. And these are the folks, these are the organizations, they're going to be incredibly critical in this post-Roe, the newer post-Roe environment. I'd like to specifically call out Access Reproductive Healthcare Southeast. They are based in Atlanta. They care for the entire Southeast region of the United States. And because Illinois is going to be one of the closest states that maintains access for our patients, we're also working really hard to develop our relationship with the Midwest Access Coalition and the Chicago Abortion Fund. These are the folks that have been doing this work, right? So as folks talk about setting up new ways, new things, like we have this, we don't need to reinvent this.
Right, exactly. We already have a lot of organizations that have been on the ground and doing this work and really working hard to eliminate some of the economic and social barriers that many people who are trying to access abortion are facing. And so I think that we really have to recognize that we have to support all of these organizations. You know, a lot of people say, oh, you know, let's give to one organization. No, there are multiple needs. And so we really do have to focus on how we can partner, because honestly, at this point, it's not even about competition. It's about how we all can come together to provide people the care that they need. And it's all hands on deck right now.
Yes, every single person. Next slide. Check us out, y'all.
Yeah, check us out. Is anything
and I think we're going to take questions.
Yeah.
I'd say for folks watching, many folks watching online, if you'd like to ask a question, you can go to the bottom of your screen into the Q&A section and put in your question, and we will ask it for you here. I think while we're waiting for people to ask that, I'm going to use my privileges being next to you all. Okay,
go ahead.
You know, I wonder somewhat about the special sauce of Choices. You serve people from over 46 counties, which is probably now much bigger since Texas restricted things. And it seems that other providers amidst these challenges, right, have cut down, closed facilities because there's not as much funding, but Choices seems to be working harder every time. And what's the special sauce that's in Choices that's seeing you sort of push back harder than ever and sort of be more of this beacon?
What's the special sauce?
What's the special sauce? I mean, I think bravery is the special sauce, right?
Yeah.
Like
I think we don't operate from a scarcity perspective either, right? We're big dreamers.
We are.
Yeah,
we
I
are.
think that. I mean,
and tell us we can't do it. Just
right.
go ahead.
Oh my
God.
Please.
Tell us we can't do it.
Show you,
We got you. Like, I mean, and lots of people said that around the birth center. They're like, people do not want to come to an abortion clinic to give birth, or people do not want to come to an abortion clinic and see people. It's like, no, they are at the grocery store together.
Right.
People that have abortions know what happened if you don't have an abort. That's why they're having an abortion. Like it's been. Tell us.
I don't know. I think that one of the things that we're really open to is learning from our community. The community has told us what they wanted, and because we have some resources, we've been willing to throw those resources behind it, you know, and that community buy-in has been really important. But we also have an amazing team.
I was gonna say we also we are incredibly proud as an executive team about how we treat our staff.
Yeah, that's really important.
We went to a $15 hour minimum wage. We were one of the first nonprofits to do that 7 or 8 years ago.
Yeah.
Just last year, we went to a $20 minimum wage.
Right.
We pay for almost 100% of healthcare benefits for staff. We provide short-term, long-term disability. We try to take care of our folks. We get time paid off. I mean, there are a few jobs that you walk into and there are people on the sidewalk trying to convince you not to go to work that
right. Yelling at you and saying all sorts of crazy things. So
but they take such good care of the patients.
They do.
And so we have to take good care of them.
Yeah.
Like I think it's good business. And
it is good business.
It's good patient care.
It is. And I think that also when we realize that really focusing on abortion only was not the way, and pivoted to really listening to Black women. That's changing and really working to operationalize reproductive justice and Black feminist health science was a really big part of what we did that also was really helpful, right? And because it made us very introspective. And so looking at ourselves, looking at any harm that we possibly could be committing against the community, looking at any harm that we could be committing against our staff. You know, we have been very open to those hard discussions. And so I think that is also what has really worked to help keep us moving forward, because we do have an amazing, dedicated staff. But also we started telling a story. Yeah, because, you know, for a long time, Choices never really raised money.
Yeah.
We kind of just kept our head down and did the work. And then we just really started telling the story, not just about our clinic, but also about our amazing patients. You know, we have a lot of resiliency in our community. One of the things I tell everybody that I really did, you know, when I started this work, it was because of me talking to people in the community and recognizing that, one, we didn't have any Black midwives in our community, but also that there was this history there that really needed to be reclaimed. And so doing that work and really working with the people in our community, it changed me as a person and as a provider. But we always knew that providing this care would change the community, right? But never in the way that we have seen. So what we have seen is it's not just changed them personally and really empowered them in recognizing how they should be treated, but it's also changed them professionally. So many of the people that we care for have now gone back to school. They're now studying to be nurse midwives. They're now lactation counselors. They're now doulas in our community health workers, and really advocating for their communities. And it's created this, it's just created this community that's on fire for justice.
And you know, just in some like our board looks like our patients.
Absolutely.
Our leadership team looks like our patients. Our staff looks like our patients, and I think that's something folks say a lot, right? Like yes, that's like, but it's really foundational.
It is,
right?
It is.
You know, Choices has always been people from Memphis doing for folks in Memphis,
Yes,
and I think that is also part of it.
Yeah.
Thank you. There are a couple questions coming in.
Okay.
One in all caps says, "Thank you so much for creating the model that meets women where they're at and offering them the best service. Would you mind if we share your access fund slide that you have on social media?"
Oh, absolutely.
Please,
Whatever,
please.
absolutely.
Yeah,
That's fine.
yeah.
Wonderful. And then Tanya asks, "Thank you for this wonderful presentation and thank you for all you do. Are you anticipating more post-abortion care, such as miscarriage management,
Yes.
self-managed abortion in your practice?"
Yeah.
We talk about that a lot.
We talk about it a lot, exactly, because we know that there have been many different things that are popping up in response to the limited access that people are having to abortion now. That we know that we're going to see more self-managed abortions. We know that more people will have to travel across state lines to get medication abortions and come back to their communities. We already do miscarriage management in our clinic. One of the things about our clinic is that we do lots of services, but we definitely do like gender affirming care. We do wellness services as well as abortion services and our midwifery services. But one of the things that let me go back and say we are a midwifery led clinic. The only things that midwives don't do in our clinic are abortions, and that's simply because of the law. But our midwifery staff sees our post-abortion clients. So if they come for abortion and they come back, we are the ones who usually take care of them. And anyone who has a missed abortion, we take care of them as well. So we recognize that we are likely to see more of those patients in the community, especially because we will be a clinic that is a safe haven for them.
There's another question. Someone says, I heard you talk about the Black Midwifery Fellowship.
Mm-hmm.
What is that? Can you explain
Oh,
some
yeah. Okay, so, well, in our country, there are very few Black midwives. There are only about 700-800 Black midwives in the United States.
The whole
United States, right? Historically, Black midwives were prolific, especially in the South. Especially because of segregation, they actually practiced in the South longer than they did in other parts of the country. And we know specifically in Tennessee alone, they had over 1,500 Black midwives well into the early 40s. But because of politics and policies and the demonization of Black and Indigenous midwives, they were practically pushed into extinction. So one of the things that was really important to me in choosing to go back to school to become a midwife in my third career, right, was that we focus on really reclaiming those traditions, reclaiming midwifery for our communities, because a lot of the families that I would talk to and interview, I'm an anthropologist by training, a lot of the families that I talked about, infant loss and their poor treatment by the healthcare community and their lack of willingness to go to the hospital and things like that because of their poor treatment. But then I talked to older Black women in the community, and they talked about being tended to and cared for by these Black midwives. And so it really sent me to a different place in terms of I recognized that I could provide care, but what is the best way to help the community? And that was through replication. And so what we are doing at Choices is we have a Midwifery Fellowship that's specifically for Black certified nurse midwives. And what we're doing is training them in our model, which is a social justice model based on reproductive justice principles and Black feminist health science, and helping them to not only be able to provide care for pregnant people and providing prenatal care and birth options, community birth options specifically, but also teaching them about abortion care and how to provide abortion care, teaching them about gender affirming hormone treatment, which is what we provide for our over 250 transgender patients, but also teaching them about family planning. So midwifery, when we think about midwifery, we think about pregnancy. Nurse midwives, scope of practice is far more broad than that, right? So nurse midwives can provide a lot of care. And so we're trying to train them in that way so they can go back to other communities and really to provide that type of care. So it's a year-long fellowship. It has a didactic component, which is really around reproductive justice and Black feminist health science. And it has this hands-on piece. But we also visit communities because we want them to reimagine how healthcare is being delivered. And, we see ourselves as disruptors to this healthcare system that is broken and fragmented. And we want them to be able to be innovative and visionaries and go back to different communities to be able to bring that to them.
Thank you. Another question is, what can you tell us about other independent clinics in the South and how they might fare post-Roe?
I'll let Jennifer answer that one.
Oh, y'all. So the Abortion Care Network, which is the professional organization for independent clinics who consequently provide the majority of abortion care in this country, is estimating about 150 independent clinics across the country will close once abortion access is eradicated in about half the states. And so I think there's going to be a mixed bag. Some of them are working around diversifying services. We're supporting some of our sister clinics to diversify, add birth, add gender affirming care, think about other ways they can contribute to their community. Because it's also you have more than abortion care. You're good at abortion care, but you also have other things you can offer to your community, right? Many of them will close. And so yet another access point in communities with few access points will lose another access for healthcare. Some of them will pivot into other locations where they can provide abortion care and continue to provide abortion care in other states.
That's not that many states in the
But there's
South.
not, well, no, I mean,
Yeah.
y'all may, I mean, we're talking of like worst case scenario. I mean, we're talking about folks on the western side of the country will be okay. Washington, Oregon, California, some other states, forgive me, I don't remember some of the square states. Illinois and Minnesota, and then our folks on the upper eastern seaboard. I did not say anything in the south of the United States, and so yeah, it's our operations director, Maria Hassel, keeps reminding us and has been reminding us for months now, with great tragedy often comes opportunity for something new to be born. And so that is how we are trying to look at this moment is there are going to be a lot of clinics that close. There are going to be people that are not going to access the abortions that they want to access. And that is tragic, and that is going to be tragic.
Yeah.
But Choices is at a place based on our diversification of services, our fiscal management. We have an incredibly healthy balance sheet that we are going to be able to weather the storm. We are going to stand in the storm with our patients, with our community, and we will be there when the storm passes.
And we're going to continue to fight.
And we're going to continue to fight. Go ahead.
Thank you. First of all, sort of a related question. When we think about the end of Roe specifically, like there's a time we have to mourn, right? Like I mourn for you all as providers, for me, for all of us. And there's this element where I think I've heard the ongoing dialogue that Roe's the floor.
Yes.
It is.
And you alluded to like maybe some federal
Yes.
changes. And so like as we're all leaving really motivated by that, like can you cast or kind of articulate a vision for like what is past Roe? Like what would you hope federally we could be advocating and voting on?
The big piece, one of the big reasons Roe is the floor is that it did not provide a way to pay for abortions.
Right.
And that is the problem in our community.
Yeah.
Without expanded Medicaid, without many people, high unemployment rates. That is the problem, is that even if folks can get together gas money and childcare and find a car or go stay with aunt or uncle,
It's expensive.
it's expensive. I mean, and abortion clinics are, I mean, it's not like the margin's high, right? It's,
Right.
you have to have 2 visits with the physician. You have to do this ultrasound, which requires this expensive equipment. You have to run these lab tests regardless if they're medically
And only
indicated.
certain people can do it.
And only certain people
Yes.
can do this thing, like
Right.
it just, so, we need protection for abortion access at the federal level, and we need expanded Medicaid in the entire country that includes abortion, right? And but also everything else, like just give people access to healthcare.
Yeah.
Like as it turns out, just give people access to healthcare. I mean,
and with
No, keep going.
No, I was gonna say with Roe being the floor, it didn't provide access for everybody either, right? You know, there's still so many barriers that many communities face, and just accessing abortion care. Like we said in Mississippi, they literally have one clinic, you know, for the whole state. And so we need protections around providers as well.
So I was going to sort of pick up on your question. So you had the slide of different places that are helping. There's Illinois, there's sister states, and sort of Roe's taking away something. If you take away something, you have to be able to give back, is my feeling. And with this group of clinics that get together for abortions and talk to each other, is there any way that there could be sort of a consortium of fundraising, not Illinois, California, whatever, that there could be sort of a main place that could help whoever needs it? If it's someone in Tennessee or Georgia, there's a main funding place, so people who might want help don't have to sort of pick and choose. But there's a main organization.
did our development director give you that question? So thank you so I mentioned earlier the Abortion Care Network.
Yeah.
And they are the professional work for all of us, our independents. They have a campaign, Keep Our Clinics.
Yeah.
And it is exactly what you're talking about. It is a central place where people can give and support, and then all the independents come together and receive support out of that fund.
Yeah.
And so yes, that is how I would answer that question. Specifically if folks are interested in supporting kind of the larger independent clinics, the Keep Our Clinics is the fund to do that with.
Yeah, I mean, and like you said earlier, the independent clinics are the ones that really do provide most of the abortions in our communities, but they don't have the same presence or media presence or public presence as some other clinics do, right? And so it's really important that we remember who is really providing this care in those communities.
Like 100% of second try care.
Yeah.
And that's for everyone online that's in the chat now as
Okay.
well. And then I think we have time for one more question. An anonymous attendee says, does Medicaid in Tennessee at least cover births that happen in the birth center?
They do. So
I don't know.
we do get some dollars.
We get something.
The technical answer is yes, they send us money
Right.
now.
The technical answer is they cover something. Right? I want to say that, first of all, we have been very purposeful about centering Black and brown families, and especially families on Medicaid. And for this reason, we lose money. Tennessee Medicaid only reimburses $1,400. Well, I'm just going to say up to $1,400 because sometimes we don't get the whole $1,400, but they reimburse up to $1,400. And that is, like I said, a reimbursement. So we have to see them, care for them, provide them all the care, and then
Deliver their baby.
right. And
then ask for our pennies on the back.
right,
end.
exactly. So it really doesn't cover our care, especially because our visits are very long. So our visits are longer than most visits that you would go and have with an OBGYN. Our visits are 30 minutes to an hour long. They have 24-hour access to us. They birth wherever they want to birth. They can birth at home, they can birth at the building. Presently, Tennessee's TennCare does not cover our facility fees. We're working on that, fighting with them on that. And also they get postpartum care, and their postpartum care is extremely robust because, most people who give birth, their providers will tell you, we'll see you in 6 weeks. Well, we see them at least 4 times in that first 6 weeks, and we actually see them far beyond that because we know that postpartum is not 6 weeks. So we have really been fighting also in our state and working with our advocacy groups about extending that postpartum period, as many other states have done. Some states have done it to 6 months, others have done it to a year. Our governor has said that they would do it up to a year, and recently they've been talking about him signing that, but we care for them regardless. And so we have a lot of patients who were on Mississippi Medicaid, Mississippi apply for a waiver where they did not have to reimburse providers who also provided abortion care. So they are not allowed to use their Medicaid with us.
We could be in Mississippi in 15 minutes from our
Right,
clinic.
exactly.
So it's a suburb, right?
Yeah. And so what we did was we continued to provide care for them.
Yeah.
And so, so I guess the answer to that question is we do get something, but it's not nearly enough.
I fear you're not selling yourself well enough. Not only do you provide care for them, you provide them better care and have
Yes,
absurdly better outcomes
absolutely.
than if they got care elsewhere in Tennessee.
Absolutely.
Tennessee is not nearly as appreciative as they should be. Dear Tennessee.
You hear that, Tennessee? Right. Unfortunately, our patients are extremely appreciative, and it really is what keeps me coming back to the building every day.
Well, we have about 2 minutes left. So I was wondering, any closing thoughts or advice or words of wisdom?
Support your Southern colleagues. We're in
The fight of our lives.
yeah,
Mhm.
it's gonna be a rough couple of years.
Yeah.
And so your support greatly appreciated, and
And this can be different.
it can be different.
Yeah,
It can be
and we're
different.
making it different. Yeah, absolutely.
Well, thank you all so much. Thank you for everyone who applied online. I just love to give you a big